Welcome back. Around 3 million Americans are living with glaucoma, the leading cause of irreversible blindness.
And while prescription eye drops are the most common form of treatment, they can be inconvenient and have irritating side effects. Joining us tonight in the studio is KSL medical specialist Emma Benson. And Emma, you are taking a look at a new surgical procedure in Utah.
That's right, because like you mentioned, eye drops, a common form of treatment for glaucoma. And of course, doctors can prescribe this type of medication, but they can't make the patients use them, which is tricky. But this new innovative procedure is actually taking the responsibility out of the patient's hands. Take a look.
All these different items are used by the plumbers.
John Ayersman describes himself as a go-getter.
And I make sure it stays organized.
Who hasn't let his eye troubles stop him.
I went to a doctor. They said, yeah, it appears you have glaucoma. That's increased pressure inside your eye, which will destroy your optic nerve over time.
The Marine Corps vet and avid motorcyclist was given eye drops to treat the condition, but found it difficult to use them consistently.
I wasn't real good at remembering.
Recently, his doctor told him about a newly FDA-approved device called iDose, a microscopic-sized implant that continuously releases glaucoma medication directly into the eye.
This is really the first device of its kind,
replacing the need for daily eye drops.
At least 50% of patients who are prescribed glaucoma medications don't use them at all or use them very, very inconsistently. So to have this tool that essentially takes this out of patients' hands and says, we have the medication that's going to work for you, and we're going to just deliver it right where it needs to be, is really a big step forward.
Dr. Rachel Simpson is the division chief of ophthalmology at the Salt Lake City Veterans Affairs Medical Center. She performed John's procedure in July, the very first one in Utah.
I'm a celebrity, I guess, huh?
So we know the medication works, and now we know we can deliver it directly to the eye. And we've never been able to do that before.
The procedure itself took only a few minutes.
I was awake for it, but they numbed my eye.
And John was back to work in no time.
I don't notice a thing. I can't tell what's in there.
Dr. Simpson says it's a low-risk procedure.
The complication rate is incredibly low,
with minimal side effects.
At first, things were a little blurry, but over time it's cleared up.
They're both hopeful this will pave the way for glaucoma therapy.
We have come so far in the tools to treat glaucoma from where we were 25 years ago. I think we will see more and more opportunities to use this device as we see how successful it is.
Well, the data shows once implanted, iDose provides up to 3 years of treatment, maybe more. They're still doing research there. You can talk with your doctor if you're a glaucoma patient interested in learning more about this device. So a pretty neat medical advancement, right?
Yeah, daily eye drops versus something that might last 3 years or more. I mean, I think a lot of people would take that option.
Exactly, and then you don't have to worry about it. So
great.
There you go.
Cool.
Thanks, Emma.